Today, mental health is an important issue in our society. Many people of various ages are trying to get help with their personal challenges related to their mental health. Also, right now, there is a significant shortage of diverse counselors and other mental health professionals from different backgrounds who can treat and assist people from various racial and gender identity groups, and also people who have disabilities. Here's a few interviews with mental health professionals who talk about their careers, giving an inside look at the profession and what it takes to be an effective mental health professional. Why don't you tell me, Michael, what your tell me about your credentials, because you got about like 18 letters and acronyms after your name. So why don't you give me all of them, the whole full gamut of acronyms and letters attached to your name?
Okay. Well, I have a master's of science in rehabilitation counseling. I earned that in 2017 from Winston-Salem State University. In that program, you had to pass the certified rehabilitation counselor exam and become a certified rehabilitation counselor. So that's what I did. I'm also a licensed mental health counselor and nationally certified counselor. In order to qualify for LMHC in this state, you have to pass the National Counselor Exam or the National Clinical Mental Health Exam. I passed the National Counselor Exam first try and got my nationally certified counselor credential. I'm also an LPN. I'm a licensed practical nurse. I got that in 2010 after doing my nursing school at Glendale Community College in Glendale, Arizona. So those are my credentials in a nutshell.
Yeah, it's a big nutshell. So when did you decide, at what point in your life, that this was the career that you wanted to pursue?
Well, my mom had been working in the counseling field since I want to say what 1992, something like that. So we'd always had social services or behavioral health in the family. I have a degree in counseling. My mom has a degree in psychology. My sister has a degree in psychology. My other sister has a degree in sociology. So social sciences has always been a part of our family's background. I didn't think of it as something for me until 2015, when I was graduating from Winston-Salem State's undergrad interdisciplinary studies program with the concentration in psychology. I was at a job fair and rehab counseling was one of the booths there, and I'd always thought about maybe transitioning or having a new career either as a teacher or something else other than nursing. I appreciated my career as a nurse, but I kind of wanted to see what other challenges were out there for me. And I saw the rehabilitation counseling booth, and I talked to the chair, Dr. Yolanda Adams, or Dr. Yolanda Edwards. My apologies to Dr. Edwards, and she seemed like a very nice person, and I just remembered the positive experiences that my mom had in her career, and I said, you know what, this might be a really good transition. I mean, as a nurse, it's my job to connect with my patients and help them. And, counseling is just another form of helping. So I found the transition from full-time nursing to full-time counseling to be fairly natural, and focusing on that holistic perspective definitely helps. Since I have a nursing background, I can talk to clients and they can talk to me about their medical things as well. And I could focus on the mental and emotional aspects of their medical concerns and encourage them to seek the treatment that they need in order to get to their point of, where they're at, to where they're at the point to where they're their best self. So that's what I like about it. You get to see people be their best person in counseling, whereas in nursing sometimes you don't get to see that. You don't get to see someone leave the hospital, or you don't get to see someone leave the facility or exit treatment sometimes. Whereas in counseling, that's the whole goal. Your goal is to get someone to not need your services anymore. So it's a really great career. And like I tell people all the time, This is something that if I had the money and I was independently wealthy, I would do it anyway. I would do it for free because I love it that much, you know. So
Well, yeah, you answered my question about what's really rewarding and appealing, because I mean, it's especially in the past. I think in like our parents' generation, a lot of times, I remember some of my uncles, grandparents as I worked at the cannery for 45 years, and
mhm,
it was a job. It wasn't really about being happy and fulfilled and satisfied. It was about putting food on the table and paying the mortgage and that kind of thing. But I think that
mhm,
we're fortunate people that work in the arts and social work and in the medical field, that it goes beyond just a job. I mean, there's, like you say, you can see an outcome. You can see somebody who says, hey, Mike, I really enjoyed our sessions, but now I don't feel like I need to come because I've worked out that issue, or whatever.
yeah.
And you mentioned something else, that you grew up in an environment where you were surrounded by people in social services. And one of the things that we talk about a lot when we're trying to recruit more diverse people into the field, it's starting at a much younger age, not waiting until somebody's, 19 or 20 at a career fair or something. Start talking
Mhm.
to them when they're in elementary school or middle school. What do you think about that in terms of recruitment? What are some of the keys to trying to recruit more people of color, for instance, to the field?
Well, I think that's a really good question. I would say the first thing to do is to gauge their interests, right? So one thing I like to do as a career counselor is I like to talk to clients about the different forms of career, right? So I like to use the RIASEC model, which stands for realistic, investigative, artistic, secure, enterprising, and conventional. It's a standard career search model that is used everywhere. Um, really engaging with the client or the participant, seeing what their interests are, doing career interests inventories. Now, as far as children are concerned, I don't have a background in career counseling for children, but I'm sure there are career inventories that kids can do. Now, when I was in high school, the only career inventory I got to do was the ASVAB, which is the military's aptitude test. And for what it's worth, that's an okay test. But for folks who aren't interested in joining the military, which is probably a lot more than those who do want to join the military. In full disclosure, I did 4 years, so there's nothing wrong with joining, but there are plenty of people who don't. Being able to provide students with the ability to assess their interests and understand what direction they might want to go into at an early age, maybe as early as fifth grade. Now, again, I'm not a counselor for kids, so I'm not the expert on that, but giving them an option to assess where they're at, focusing on practical skills related to that career, possibly giving them an outlet to pursue the trades as well, might be a way to help diversify a student's interest. Now, when I was in school, we didn't have much. I mean, we had a career exploration class, we had economics, we had family consumer science. But if you really wanted to dive into a trade, if you really wanted to dive in and see what a certain career was like, we didn't really have that. I think the most I did was uh, like they called it an internship, but really you were just like helping people with basic computer problems. That was like the most that I did as a kid. So really being able to dive in and maybe in those last 2 years of high school, really being able to dive into a career, learning a trade. There's actually a school in Mesa, Arizona, that was offering kids free certifications. Like they had an LPN program. I didn't know about this until after I graduated high school. As an example, Paradise Valley High School also has a trades program as well. So giving students an option to know where their pathway is rather than just saying, oh, well, you're going to do 4 years. Well, what do you want to do? right? What is the interest inventory we can use to help narrow things down when you're in fifth, sixth, seventh, eighth grade? Maybe this is the path you want to go. And if they change their mind, that's okay too. Saying, okay, well, you don't have to go that route if you don't want to, but giving them an avenue to know what's out there, and having an interest inventory of some sort, or some type of profiler tool that they can use might be helpful. So.
Hmm. Well, I'm just thinking that meeting people like you or meeting people in the field as well, and getting
Mhm.
that more boots on the ground, what it's like a day in the life of a therapist or something like that, kind of,
Yeah.
I think helps kind of, really give them a sense of realism, which leads me to my next question, which is, what are now we've heard about the school and getting certain degrees and certifications and all that. What type of temperament or personality is best for a person who's thinking about being a counselor or a therapist?
Well, I would say keeping an open mind. So we talk about principles like, unconditional positive regard, meeting the client where they're at, not being so directive, right? Now, it's okay to be directive when it's absolutely necessary, like in times of crisis. So we talk about if a person is in crisis, or they're being like, their behavior is something that might be a danger to themselves or others, being more directive in that case is definitely warranted. But keeping an open mind, being able to look at things from different angles. I always say to clients, there's three sides to every story. There's your side, there's their side, and then there's the truth, right? So we want to work towards finding, building that common ground between people, and being the peacemaker, right? We don't want to be someone who is overly confrontational. I remember going to a conference when I was an undergrad, and they listed all the different ways of providing intervention for folks who are having substance use problems, substance use disorder, and whatnot. Um, and there was about 50 different interventions. I don't remember all 50, obviously, but the one that was at the bottom of the list was confrontational counseling. And this is what people think of when they think, oh, yeah, this is, you just need some tough love. You got a substance use problem. You need some tough love. You need somebody to sit you down. And one thing they found in this research that I saw in this conference, and things may have changed since 2015, but they found that confrontational counseling is at the bottom of the list. So being non-confrontational, non-judgmental, having a sound, balanced viewpoint towards things, not rushing to judgment. That's what we're looking for in the counseling world, or at least that's what I would look for if I was looking for a therapist. Someone who can listen to what I have to say and give me the ability to process and find options without being judgmental. That's one thing that I see from clients a lot, is like, I don't want to go to a counselor because I don't want somebody making me feel bad for my decisions, right? So that's one reason why some people stay away. They don't want to feel judged. They don't want to feel overly looked down upon because of decisions that they may have made that may not have been healthy for them. So
Yeah,
that's
that's
where I was. Yeah.
well, yeah, that's a good point. And we've talked about barriers to healthcare, and some of them are more tangible, and the system or the paperwork or lack of insurance. But then there's also the psychological end of it. Last
Yeah.
question is, how important is it to have, or what difference does it make if you're what color or racial background your therapist is? How important is it that people are, especially in certain situations, have a therapist who has their same maybe gender background or gender identity as well as racial background?
Um, I think it depends on a lot of different factors. So, as a counselor of color, I often will see clients in the BIPOC community, and here, especially since people who are BIPOC are especially marginalized in Washington, as it's a majority white state by far. Um, you do have that sense of camaraderie, or sense of feeling more secure talking to me, just because I'm a member of the BIPOC community. But I do also think it depends on the level of cultural heterogeneity of the area. So, for example, in Arizona, it's a lot more culturally homogenized. It's a lot more mixed culturally. There's a lot more Hispanic people in Arizona than there are in Washington State. Um, there's it's about the same ratio, I would say, of African Americans, and there's a lot more Native Americans. There's a lot more Native American presence, in my opinion. Now, am I a sociologist? No. Someone will probably fact check me on this, but I do feel like there's a lot more presence there and a lot more melting pot in Arizona than there is in Washington. And with that aspect of it, there might not need to be as much focus on race. However, it's always important for every counselor to acknowledge if there is a power dynamic, right? If you're a white female social worker, which most social service workers are white and female, that is a fact. Um, there might be a power dynamic between someone who is in the BIPOC community. So it's important to acknowledge that. It's important to recognize and really get the client's opinion. You know, do you feel comfortable talking about certain things? What are some things that you feel like you are comfortable talking about? What are some things that you're not comfortable talking about, and why? What can we talk about? And also understanding racial identity models. So I like to talk to clients who are having some concerns about cultural identity, talking to them about racial identity models and what that process looks like as well. So it's a very complicated thing, understanding race and counseling, but it is important to address it, and it is important to be as non-judgmental and as culturally appropriate as possible, right? So if you're a white female counselor and you start talking slang to a black male client, that's probably not clinically appropriate. That's probably not something that you should be doing. You should be as clinically focused and as non-judgmental as possible. Just like if I'm talking to someone who is, you know, of a different culture, someone who's Native American or Mexican, and I start leaning in towards those cultural stereotypes without, you know, without any regard for that person's feelings, that's wrong on my end too. So we all have to be aware of our own biases, and we all have to acknowledge if there is something that is amiss. So.
Mhm. Well, I think one of the key words is awareness, self-awareness, awareness of other people, awareness of potential potholes, so to speak, that you can step
Yeah.
in if you're not careful. So, all right. Well, thank you very much. Are you thinking about going into a career as a mental health counselor? How do you prepare for such a career academically? What kind of temperament and personality is needed to be successful and effectively help people? I got the answer to those questions and more when I talked to Jennifer Hippolyte, an experienced licensed mental health counselor who works in Bellevue. Here's that interview. Yeah. So why don't you give me your name and just tell me, you know, just a little bit about where you're from and how long you've been in the area to start off with.
Okay. My name is Jennifer Hippolyte. I'm a licensed mental health counselor associate. I was born and raised in New York, so spent most of my life in New York. That's where I grew up, and my parents immigrated to. So my parents are of Haitian descent, and so are my siblings. Yeah, I just grew up around a lot of other nationalities and cultures as well, in New York City. And then I moved out to Atlanta to do all of my schooling. So that's where I went to undergrad and grad school. And from Atlanta, I moved out to Seattle. So been in Seattle about 2.5 years, um, out here just working in the field.
And what was your major in college?
So in undergrad, I majored in psychology.
So what initially attracted you to this field, and what age were you when you first thought, oh, I might want to work in mental health?
I knew from a pretty young age, actually. I feel like every time I tell people that in middle school I knew I wanted to be a counselor, they're like, really? But I think it's just naturally just who I was. It was part of my personality to be a listener, to be an advice giver to people around me, my friends. And it was just natural to me. Like I just enjoyed doing that. So I knew that I wanted to help people with their problems. Like I knew that for sure in middle school that I was going to be somebody helping people through their problems. And I knew it was going to be some type of mental health thing. So the first thing that came to mind to me was like, I'm going to be a psychologist. Um, but I think I really honed in on it when I took a psychology course in high school as an elective. And I believe it was my junior or senior year. And that really like honed it in for me, like, oh yeah, I love this. Like I loved that class. I loved learning about the mind. And I knew for me, like, okay, anything with like mental health is gonna be for me.
That's a great answer because it leads into my next question is if you were talking to a young person or even an older person who's thinking about, maybe I might want to go back to school and take psychology or get into mental health, what kind of advice would you give them as far as first we'll talk about education, how important that is, but then also temperament, personality, because, it's not always easy when you have clients that are dealing with some, sometimes severe mental health diagnosis. And I would think it would take a certain kind of temperament, I guess, or personality. But first, what about education? How important is education? And what advice would you give to a potential student who's going to enter that particular major, even in college?
Yeah, education is huge. I think if you are coming out of high school, going into college, you might want to do some research and hone into um, what area of mental health you want to go into, because there's so many. Psychology is a very general degree. So for most mental health clinicians, you have to get a master's. So you can't practice without getting your master's. So I think before going into that, knowing what you want to do, particularly in the mental health field, will be really helpful to know, hey, do I want to work as a community mental health counselor? Do I want to work as a social worker? Do I want to be a mental health professional in a hospital setting? Do I want to work in the school setting? Do I want to be a psychologist, which is a higher level of being a clinician where you usually get your doctorate. So yeah, I think just honing in on what sector you want to be in, it will be helpful in figuring out like what do you want to do in mental health.
I'm glad you brought that up, all of the variety of sectors, as you said, because I think sometimes what happens is if you're not familiar with a field or, you watch TV, it's like people who used to, I would talk to students sometimes who wanted to be an attorney. And I said, well, why do you want to be an attorney? And they would tell me, well, I watched a couple of TV shows and I see the lawyers and, they drive nice cars and they get to stand up and do their big kind of summation and all that. So they kind of see one aspect of it. And I said, well, you need to know also about law school, taking the bar, staying up till 4 a.m, reading through case law. I mean, it's not all glamour and money,
Yeah.
kind of like the entertainment industry. I mean, you see the actors on stage in a movie and they're making a lot of money, but you don't see the rehearsals and the classes they have to take and all that stuff to prepare for that.
Right. Yeah, exactly. So, yeah, I mean, again, with each sector or type of mental health professional you are, there's different requirements. Like internship hours, how long you have to go to school, what type of individuals you're working with. Like, you can be working with people with more severe mental health illnesses versus helping people cope with just everyday life issues. So, those are the things that you want to look into.
So what type of temperament is good? Patience, listening skills, not taking it personally when people get angry at you?
Yes, all of that and more. It takes a lot of patience. And listening is like the number one thing. And it's not as easy as it sounds. Being attentive, because people are coming to you, and some of these people who come to you don't have people to listen to them. So in those sessions, the time that you have with them, you have to be really, really attentive, so that you can know, what needs to be said, how you can help them process things. Another big skill is empathy. And that's not a skill that everybody has, but most counselors do or should have, because empathy is just being able to put yourself in somebody else's shoes. And it's different from sympathy. A lot of us can feel sorry for somebody that is going through something. But when you're empathetic, you can really feel what they're feeling. And that really helps you be there with that person. So meet them where they're at. And I think that's like one of the biggest skills that you need to do this work.
Well, maybe if you could, without mentioning any names, of course, just kind of describe a typical day, because you mentioned before we came on that you were finishing up with a client. So why don't you just kind of describe kind of, your daily kind of routine and schedule?
Yeah, so I see clients between the hours of 2 p.m. and 8 p.m. So usually, because I work in private practice, if I didn't say that. So I have an office space where I see clients individually or as a family, to have times with me, one-on-one sessions. And the sessions are about an hour long. So depending on the day, I may have sessions back to back. So between 2 and 8, I'm seeing clients hour on the hour. Some days I have a little bit of time in between. So maybe a client at 2, another at 5, and another at 6, and another at 7. But the between those times, I'm catching up on notes. So I take notes during sessions, psychotherapy notes. As a clinician, you do that for yourself. So these are just notes that you keep for you, because you're seeing a lot of different people. So my the amount of clients I have right now are between 15 and 17 clients a week. So yeah, that's a lot of different people that you're, keeping up with. So I keep up with notes for them. Um, Sometimes I have to send out what's called super bills, which are just like basically an itemized description of the services that they're getting. So basically something that they can give to their insurance to say, hey, I'm seeing a counselor and I need to get reimbursed for for what I paid to see this counselor. I'm also consulting. So I have a counseling supervisor who I talk to, and they're basically a counselor who's been a counselor for a very long time and help me process some of the cases that I'm dealing with. They may see things from a different way than I do. And that helps me, be a better clinician to my clients. Doing that, responding to emails. So I go between seeing my regular clients, usually every week. So I have weekly clients, I have a few bi-weekly clients, but I also am having intakes, which are new clients that I'm seeing. And that's a process too, where, they're coming in, they're filling out paperwork, and we're going through that together. Um, uh, what else? I'm trying to think
Well,
about.
I think you've done a great job at just painting a picture of, the variety of things that you do. And also, as you were talking, I was thinking organizational skills is really important. A certain amount of diligence, taking notes, getting them organized, because like you say, you see a lot of different people, and I'm sure that sometimes they can kind of overlap in your mind as far as what the issues are that they're dealing with. Last question is, what do you enjoy most about what you do? What's most satisfying, rewarding?
That's a great question. I think for me is sitting in sessions with individuals and us both having an aha moment. So just because with therapy, the thing is, it's a process, right? So it's not like you come to a therapist 2 times and you're fixed. It's really a process. It's a journey. Some people are in therapy for a couple months. Some people are in therapy for a year or more. It just depends on what's going on. But I think those moments in a session where that counselor client relationship is what it's technically called, but when you have a counselor client moment where we're feeding off each other, like I say something and they get it and it's clicking, and I see that they get it, and we're having just this moment of like, we get it, like this is something that we understand, and it just feels good to know that this person is growing, they're learning, they're overcoming. I think that feels good whenever you get bits of that in sessions, because again, I think people may think like, oh, it'll just get fixed in X amount of time, but honestly, you don't really know. But when you get bits and pieces of that, whether it's one client or several clients in the day, it just feels really good to know that the person that I'm working with is getting better. Yeah,
It's a
that's a
breakthrough.
very,
I mean, I think
yeah,
it's
breakthrough.
it's when you think this is why I got my degree and this is why I studied so hard and that kind of thing, that you see the results, I think. Because it's real easy to have jobs where you don't even see the results. And I mean, there's people in different careers where you don't necessarily see a change.
Yeah,
You're performing certain very important tasks, but
yeah,
even something as simple, I compare it to like being a good plumber. You come to somebody's house and when you leave, the water works and everything's great. So it gives you a feeling of like, hey, I
right.
there was an outcome based on my effort. So, and I played a role in getting this person. They didn't do it totally on their own and I didn't do it on my own, but we did it together. So I think that, that has to be
Yeah,
satisfying.
yeah, the process of doing it together. And I
Mhm.
tell my clients that at like the very first session, we're gonna do this together.
Mm.
And when I see that happening, it just feels really good that we work together to get to a better place.
Mhm. All right. Well, thank you very much.